Well, earlier I spoke to the Health Minister, Norman Lamb. Minister, how long before the NHS will be fit for purpose?
Well, I think first of all we should recognise that an awful lot of fantastic work goes on in the NHS, and most people who go into work in health and care do so because they want to care for people, and we shouldn't denigrate the whole of the NHS because of what's been exposed through this report. But anyone who cares passionately about the NHS has to face up to the failings and recognise that there are significant challenges here we have to take very seriously and address them, and it will take time.
Let's look at one of these schemes, the scheme whereby nurses entering training may perhaps have spent a year as a healthcare assistant. Who's going to pay for that?
Well, hospitals have to employ healthcare assistants anyway, and so we will pilot this so that we can assess the cost of it and decide
how many
long
pilots
it should be. Well, look, we will do the work that is necessary, but I think let's just focus on the purpose of this.
We understand what the purpose is. That's been clearly explained.
And so
what we want to know is what you're actually doing. What is the scheme, and over what period of time?
Well, we will do the pilot so that we work out how it works, but the principle that someone who goes into nursing should first of all get to grips with the fundamental importance of good care, of doing the really difficult stuff that healthcare assistants do, I think is really important. I think actually we welcome by very many people.
Well, we assume you think it's important because you're introducing it. I'm just trying to find out some details about it, like who pays for it, how big it is, and how many nurses are on it.
Well, the cost will vary depending on which part of the country you're talking about.
Do you know how many pilot schemes there'll be?
No, we will do...
Do you know how many nurses will be on them?
Jeremy, we will do the work that is necessary to establish the cost, how it will work to best effect. But the principle is a very important one, and we will implement this.
So you don't know what it'll cost, you don't know how big the pilot schemes will be, nor do you know how many people will be on them.
And it's not, of course, that's why we are doing the pilot, so that we can establish...
You're sort of piloting the pilots, are you?
No, we are doing the work that is necessary to see how the scheme will work.
It will not affect any of the nurses working in the NHS tonight, will it?
No, of course it won't.
No. Can you tell us, do you think the number of nurses in the NHS is too large, too small, or about right?
My feeling is that we have about the right number of nurses in the NHS, but there will be...
That's about the right number since you shed the 5,000 since you took office.
Jeremy, there will be... Well, we didn't shed that number. There will be some... Let me deal with this. Because it's really important point you raise. There will be some hospitals who have made poor judgments about the levels of staffing in their hospital. That's why it's very important that they are held to account. That's why it's so important to introduce the Chief Inspector of Hospitals, who can identify where bad decisions have been taken and require change.
Can you help us with this question of the duty of candour and the dismissal of people who are found to have been grossly incompetent? Will they be criminal offences?
Yes, the criminal offences, first of all, will certainly be on the organisation. And Peter Walsh, who has been, in a sense, the most prominent campaigner for the duty of candour, has said this morning that this will be the most significant advance for patient safety for very many years.
So
now, we will introduce
that. Go to prison, could they, if they fail to comply with the duty of candour?
Hang on, let me repeat. We are clear that the duty of candour, as Peter Walsh has campaigned for, will apply to the organisation. What we will look at also... Let me just... You're looking concerned, Jeremy.
Well, I'm interested, that's all.
Look, we've brought in Don Berwick, who is probably the world's leading expert on patient safety, to report back to us on how we achieve a culture of zero harm in our health service. Let's wait to see what he says before we make a decision on whether we should apply it to individuals.
By your understanding of these changes you propose to bring in on candour and gross misconduct, how many of the staff involved in the Mid-Staffordshire scandal would have been found wanting and punished?
Well, it's invidious to identify individuals.
I'm not asking you to name people, I'm asking you for how many.
Let me respond in this way. the failings that were identified in Mid-Staffordshire should mean, in my view, in circumstances such as that the managers responsible in that organisation should not be able to retain their jobs and should not work in the NHS again. That's why we are introducing a barring scheme for senior managers who are identified as having been responsible for very serious failings of care.
Had these changes been in effect then, would Sir David Nicholson be head of the NHS?
Well, again, we have to ask the question, who is accountable? And I looked to the Francis report to identify that, and he talked about the danger of singling out and scapegoating one particular individual.
You also say that as part of coming to understand the NHS, senior civil servants and ministers, in which you include yourself, obviously, will be doing frontline work in the NHS.
Yep.
Does that mean that there are some viewers watching tonight who could find you emptying their bedpan?
That might be a scary prospect, Jeremy, and of course I will work, but I think it's really important not to do it in a blaze of publicity, but for ministers and civil servants to see what it is like on the front line.
Have you done it yet?
Experience that. No, I haven't, but I will do it straight away. I'm not delaying on this. I think it's the right thing to do.
So there could be viewers who have you emptying their bedpan?
They could be, Jeremy. How would you feel about it?
Well, I would be decidedly in two minds, I think.
Well, I think I can manage to empty your bedpan.
Well, thank you very much. I look forward to that.
It's a pleasure.
Well, with us now to discuss this is Jane Cummings, the Chief Nursing Officer of England, Dr. Kevin Fong, Consultant Anaesthetist at UCLH, and Dr. Neil Bacon, founder of the medical rating websites DoctorsNet and I Want Great Care. Can we start with this question of nursing? This idea of an extra year as an assistant, is that a good one?
I think what's important is for people to have the opportunity to get some work experience, and we've got some good evidence from nurses that say they enjoyed doing some work experience before they did that, but there is quite a lot of variation. So what we're proposing with this pilot is to test out whether spending time as a healthcare assistant really makes a difference to the nurses of the future, and we need to pilot that very carefully to do that.
When do you think it was that nurses decided that that sort of intimate care of patients was beneath them?
I don't think many nurses do think it's beneath them.
Well, why is this necessary then?
Because there is some people that say that there's the too posh to wash is something that we hear all the time in the media. The nurses I speak to, the students I speak to, absolutely fundamentally believe that they are there to give fundamental aspects of care.
Well, then why do they
as
need
well
this
as
training?
The complex thing. I think they need. We're testing it, aren't we? That's the point. Is we're piloting it. We're looking to see whether it means.
You're talking about work experience.
No, I talked about working as a healthcare assistant, as work experience, which enables people to test out whether it's right for them. We do know that some nurses drop out of university quite early because when they actually spend time on wards and caring for patients, realise that it's not for them. And this is one way of allowing staff or our new nurses to test whether it's right for them, and to see that they truly understand the role of a nurse as well as they do the academic and complex needs that patients have.
Do you mean some of them don't understand what the role of a nurse is?
If you come straight out of school, I think there may be some nurses or some students that may not understand fully what that role is. We certainly teach it. They spend 50% of their time in clinical placements working on wards at the moment. This is a way we want to pilot whether or not actually spending time as a healthcare assistant makes a difference to their training and how they feel when they qualify.
Dr. Bacon, do you think this extra training for nurses will make any difference?
No, I don't think it'll make a difference. The vast majority of nurses are fantastic, and to single out this hard-working part of the profession for the blame, when the Francis report was quite clear, the problems were systematic. They went from the top of the organisation to the bottom.
Do you understand where it's... I mean, sorry, you're nodding in enthusiastic agreement.
Well, it is slightly strange to me that this is the single strand of spaghetti you pull out of that whole 290 recommendation report.
Well, it's not the only strand they pulled out.
Well, but you're principally going again for that nurses have stopped caring thing. And I mean, it's difficult because working in hospitals, and I've 15 years qualified, worked in a dozen odd hospitals. It's not the NHS that I recognise. The vast majority of nurses I've ever worked with do care. You don't go into that job because you don't care. You don't go for the great pay and the glamorous working locations.
Sure, but the government has addressed as its manifesto today, its overriding duty, the injection of compassionate caring, this as if somehow it's gone.
Well, and I'm not entirely convinced that it has gone. I don't know. I'm not sure that look. The mid-staffs one is remiss not to recognise that something went very wrong there. But in the NHS as a whole, and the nurses that I've known and have worked with over the years, that is not what they're like. They care very much about their job. It's not a job that I think you can do for any period of time unless you care.
What about this introduction of a duty of candour?
Again, what we really want is transparency, isn't it? We want to know that the NHS is great all the way along. The duty of candour, that's going to tell us when we made mistakes. That's not transparency. Transparency is for you to know that if your family are going into a hospital, that it's a great hospital, that there's simple, clear, comparative metrics to make informed decisions. The duty of candour isn't going to deliver transparency. It's not going to increase the trust in the NHS that we need.
Again, many people would be surprised that it wasn't there already.
Indeed, they would, but I think that just shows us still how far the NHS is away from the rest of society. You can find out about every hotel in London from your phone. You can't find out about the quality of the NHS, and that's got to change.
I think the duty of candour is a good first step. I think that it's easy to say, difficult to back up. We made a Horizon documentary that aired last week that was all about the comparisons between the airline industry and healthcare. And in the airline industry, the declaration of mistakes is seen as a culture of learning. I would prefer to have heard, instead of a culture of zero harm, a culture of learning from mistakes, because that's what we've got to do. We've got to learn from mistakes. You're
all terribly defensive of the NHS. I just wonder whether what one learns out of all of this is that in some respect, the core function of looking after people, treating people, caring for them, making them well, has been lost sight of in pursuit of some greater self-obsession within the NHS itself.
I think you're exactly right, but I'm not defending the NHS. I'm defending the people who work hard to improve the NHS. Patients want more from the NHS. They want transparency. We can't defend the NHS as it is. It's broken and it needs to improve.
When did it break?
I think if we look back, these problems have been long-standing.
Well, I think the issue for me is not necessarily that the NHS is broken, but there's quite a lot of variation. So, again, like the colleagues around the table, I spend a lot of my time in hospitals, in services, talking to patients, talking to nurses, seeing what they do. But we know, and the Mid-Staffordshire inquiry is a very good example of that some people get poor care. And when they do, they don't ever forget it. And it's a betrayal of what we stand for, and the key issue for us is about making sure that we are very open, we're very transparent. Yes, we learn from mistakes, but we truly give those patients the care that they deserve. And there are things that we're doing, there are things that I'm doing with my nursing strategy that I launched at the end of last year that are truly working to make sure that we can improve that variation across the country.
And I think broken's quite a strong word. It's not perfect. No system is, and no one would ever tell you it can't be improved. And all of these steps are required. But when you say candour, you also need to back that up with listening, and that's really important, because sure, it's okay to have staff saying this is going wrong, but the hierarchy above them need to listen and need to be prepared to hear things that they don't want to hear.
Accountability will be a good thing there among managers, won't it?
Accountability is good, but you know. In addition to the discussions about compassion in the Francis report, there are over 100 different mentions of staffing levels and the resources required. And sometimes the answer to these problems is, actually, we don't have enough resource.
I don't think you can say that, because we see hospitals in the NHS which are fantastic, which deliver great experience and great outcomes, and they're next to hospitals with the same number of staff who just can't do it. We need real transparency. We need to listen to the voice of patients, and the voice and the experience of our patients should be at the heart of everything we do.
The other big question is whether the NHS, which is already confronted with a huge raft of changes coming in, an enormous institution, huge changes, can cope with this as well.
The best parts of it can. Walsall Hospital looked at this 18 months ago. They said, we're going to listen to patients. We're going to ask every patient to rate and review their care. In 18 months, that hospital went from one of the worst in the country to one of the best. Infections went down and staff morale went up. We can do this. We can change the culture, and we can do it quickly.
Do you think the NHS can do it?
I think the NHS can do it. We have got lots of experience, as you've heard, where organisations have really made a difference and really improved care. And listening to patients has got to be one of the most important things we do, but also listening to staff and triangulating what our staff say with what patients say. The staff experience is
the only
critical.
thing that matters is the interest of the patient.
Exactly, but what patients and what staff say together are such a good indication of how things are in that particular organisation or that particular ward,
right.
and we need to listen to them and take action to improve.
Thank you all very much.